Here you are. Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about the defense mechanism that I'm calling here explosion. Let's get started. So what do I mean by explosion? How is it a defense mechanism and how does it harm the person? Well, what I mean by explosion could also be explosion, explosiveness, explosive emotions. And what I mean by that is if we think about defense mechanisms, what's the point of defense mechanisms? The point of defense mechanisms is to protect the other, not you, not the user of the defense mechanism. Defense mechanisms protect ideas, beliefs, thoughts, states, whatever, of the person that been given to that person by a caregiver. So what does explosiveness then do? Well, explosiveness is kind of the other side of repression. And both of these have the purpose of removing feelings from a person. So if we think about it, if I have anger coming up within me, and that way, say repression comes in, repression is another defense mechanism, it would remove the anger and I would never feel it. Now, if anger is an emotion I'm not meant to feel, if love is an emotion I'm not meant to feel, joy is an emotion I'm not meant to feel, then repression would come in and remove it. And when I ask you then how you feel, you'd say, nothing, I don't know. Now, on the other hand, explosiveness would be the emotion comes up. Oh, that's really hard to hold. Out. It goes all the way out of you. And that's another way of not having an emotion. And I think a lot of people think that particularly when it comes to anger, like just being like frothing at the mouth, that means that you have a lot of anger. No, the frothing at the mouth, the yelling, the screaming is an attempt to let go of the emotion, get it out of you with the delusion that if it's out of you, then it's problem solved. Which is just the converse of the idea of if you can just kind of bury it, then it's solved. Both of those are harmful, and explosiveness is harmful to the person because it doesn't actually allow the person to listen to their emotions, make sense of their emotions, put their emotions into context. Rather, what happens is the emotion comes up, and when it really builds up intensely, builds so much anxiety, the person can't hold it anymore and they just explode out. Now, how does this actually help a caregiver? Well, it depends on what the situation was, but more often than not, it comes from an aspect where the caregiver cannot tolerate the person to actually experience a certain level of emotion, to actually hold a certain level of emotion, and that they have to get it gone, that they can get it gone through explosiveness or get it gone through repression. Either way, what happens for the person feeling this kind of explosiveness happening and not being able to actually feel their genuine emotion is they don't get all that useful information that they could get from just being able to hold the emotion, look at the thoughts associated with the emotion, and the urges for action that come with the emotion. So if you have a patient, a friend, a colleague, whatever, that you're trying to help yourself, and you find that you're explosive, remember, that's not a way of actually dealing with the emotion. That's just another way of getting rid of the emotion. So you could say to the patient, for example, if you don't get rid of your emotion through your mouth and you just hold it within, not drown it, but hold it, how do you then feel that anger within you? For example, or joy or love or whatever it is. I hope you found this video useful. I hope you like it. It's part of a huge series on defense mechanisms that I'm making just to set things straight on defense mechanisms. If you enjoyed it, if you liked it, please do press that like button and watch the rest of the videos on the series as well. I think there's going to be something like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 defense mechanisms that I'm going to address. So yeah, I hope you enjoyed the series. If you do, press a like. Let me know. Thank you so much. I'll see you again for the next one.